In the 2023 survey, there is about 1 million Malaysians have the mental health issues.
So at MindNexis, so we wanted to address this gap through an integrated model of care. So we are bringing together psychiatrists, psychology, counseling, and allied health services under one roof to provide coordinated support for individuals, couples, families, children, adolescents, and adults. Right? So this multidisciplinary approach allows our clinicians to collaborate, align treatment goals, at the same time support both clinical and emotional well-being in a structured manner. We also provide targeted support for neurodivergent profiles, cognitive challenges, relationship concerns, family dynamics, extending beyond traditional therapy model. And in parallel, we want to continue to develop and explore innovative therapeutic approaches. So we also would like to work, and our work here is grounded in evidence-based practice. Right? We understand that every individual needs are different, and which is why our care plans are personalized. That is from stress management to anxiety to trauma, executive functioning challenges, and developmental support. So we ensure that all our clinicians apply structured biopsychosocial treatment planning and evidence-based therapeutic approaches. So beyond clinical services, MindNexis is committed to strengthening mental well-being in the wider community too. So we want to work with schools where we intend to train educators and perform student psychological assessment services, corporate training for organizations, and workplace to promote mental health literacy, to reduce stigma, and to ultimately equip people with practical tools to support psychological well-being in everyday environment. Looking ahead, so MindNexis is focused on building a future where mental health care is more accessible and supported by digital innovation. By combining clinical excellence with technology-enabled pathway, we aim to reach individuals earlier, guide them more effectively, and connect them.
While the signing ceremony takes place, Global Doctors aims to complement MindNexis by providing comprehensive medical expertise, clinical assessments, and integrated healthcare support to takes place. Each group of mental health care services aim to complement MindNexis by providing means to a structured inpatient stabilization and long-term supportive care when clients require.
So MindNexis is actually a multidisciplinary care center integrated with neuro disability and all kinds of brain injury, all kinds of neuro issues. And also, what do we have? Cognitive challenges, relationship concerns. We have psychologists, psychiatrists, counselors, and also allied health professionals working here.
If you see in the 2023 survey, there is about 1 million Malaysians have the mental health issues. And last year, if you see, there is a SOS calls to the helpline is about 95,000 people. You know, it was grown from 50,000 to 95,000. So there is a very significant people are suffering with some kind of a depression or anxiety or any other things. And also, especially look at the younger adults, it's a lot of challenges about abuse or a drug abuse or people with a cell phone. So we are addressing all kind of problems. So we build very sophisticated infrastructure here to address, and we will bring a lot of technical stuff using AI and other stuff like neuroscience, AI and everything to solve this problem. And soon we'll be setting up multiple facilities across Malaysia.
Does insurance cover this kind of issues?
Yeah, so I believe at this point in time we have AIA general insurance that covers the major mental health condition, where clients can come and see a psychiatrist. Yes, and they will be, will be covered, provided there is some clause, definitely.
There are many overseas insurance that cover. However, local insurance needs to catch up with it.
There is also, we are working with Tune Insurance. We'll be announcing it very soon, a partnership with them to provide for their Tune Insurance people for even a visitor's coverage, also the local people travel outside.
Okay. Because I know some insurance companies in Malaysia, they don't cover.
They're slowly adapting that.
Also property policies. This kind of, mental health. So mental health is considered
Definitely.
resign.
Yeah, so one of the work that we would like to do is advocate for that, like strongly advocate and ensure that we create the awareness.
And on the more important thing is, many companies, insurance covers on the employer assisted programs, EAP they call. So like your physical wellness check and everything, that includes mental health also. That's what, so we are targeting that.
Nice.
Any other questions? So you mentioned something about the AI. Perhaps you could elaborate a little bit more on how does AI and mental health?
Okay, so there is the first thing is self-assessment itself. Okay, right? So a lot of people can come to take a self-assessment test without even consulting a counselor or a clinical psychologist. Can somebody close that, please? Thanks. They can able to consult. And also what we are doing is the next level we are coming up with a AI version in our Zilloy, which does a automatic, okay, self-assessment, and also it predicts more actually, from your, it detects your mild, moderate or severe, and then it can able to do enable. And one of the thing I told you, the neuroscience one, where basically what you can do is you can come here, is put on your head, it start analyzing, and you have to do like a 10 sessions. It sees the pattern, like how you take your ECG or X-rays kind of a thing, it does that. So AI is basically, they all follow something called CBT, cognitive behavior therapy, okay? And all these are driven by this in the process of AI. See, the biggest challenge, if you see, number of qualified clinical psychologists like Dr. Lokesh or Citra is very, very limited, okay, number of people. So the AI helps you to do a lot of self-deduction. And also some people initially, whether do I have suffer the depression or anxiety, they can able to run the test and everything through the AI.
Rosalie, you wanted to? Oh yeah. Who is your primary focus? Is it include the teens and kids or just adults? All actually. All
So from the,
all ages.
Yes.
so if you see one of our room, there's a kids room also.
Yes.
All ages.
How does MindNexis differs from government clinical psychiatric hospitals and other clinics?
Okay, so I think I will first say, then probably these two they can say, because they have worked in different places. I think we are the only one bringing the state-of-the-art technology combined with the physical counseling and everything, right? Psychiatry, covering from different type of aspect, neuroscience and everything. And then hospitals are different actually, right? Where the rehabs and hospitals. So we tied up with those people actually. From here we refer somebody who's in a severe case, they can't be just treated by counseling or psychology. You got to send it to hospitals. And similar facilities, if you see, I think we have seen what are the gaps in them. That's where we built very unique here, bringing the technology and the physical human interface kind of a thing. Maybe you guys can add up. Okay.
So what is the one main highlight of MindNexis is that we kind of focus on the time. So if you see the government sector, there's a long waiting time, and if you look into the private sector, there's limited, services. It's not like a one-stop center for all the services. So here in MindNexis, that is the specialty. So we have all this integrated in one place, where therefore we help the clients to ensure that they get the treatment in a timely manner. Yes. Thank you.
So I think on the government side also, it's mostly high-risk patients. And most of the time, they actually say they have no beds to admit these patients. And for that, I think people can walk into our center to see patients. I mean, we can see patients till late, till 9 p.m. we are open. So that would help people to get help. Although there's no admission, however, we still can see patients on a timely manner.
So one of the things that was brought up earlier was affordability. I think that's a big problem, especially with accessibility to mental health treatments. So how are you going about that part? How are you justifying the accessibility part?
So I think for that part, we did consider about affordability. We do have interns to work here. However, like most centers, the interns do not have the supervisor on board. However, like Dr. Luhis and many other consultants here, they are 5 years and above, and so they are supervisors to the interns. So they are stationed in this center itself, and interns can see them, and that's about 50 ringgit to 80 ringgit per session.
So when you say interns, you mean interns who are studying to become clinical psychologists?
Yes, but they are in the practicum.
Okay,
Yeah.
but those interns are short term, so they will go and
They can join us long term as well.
But
Yes, they are.
that's still a problem. I mean, somebody who needs long term
Yeah.
care can't keep going back to an intern and rehashing the same thing over and over again. Ultimately, I think long term care,
Yes.
mental health care is important, and affordability is a big problem. And it was mentioned, so
Yes.
that's why I'm asking.
We are also working on working with the government to sub the fees of so grants and things like that.
So literally, like you say, is we have like various disciplines here. So even the child psychologists and etc. And we also have junior psychologists and also senior psychologists. And definitely, any treatment that we're going to provide will be supervised by the senior psychologists here, the head of clinical and the counselling. And we're always happy to provide the service. Yeah, and if let's say there's someone they're not able to afford, we are not definitely not going to send them back, but we can actually try to look into what are the best treatment options that we can provide for them. Yes.
So is it like a pay by skill kind of thing?
At this point of time, I think maybe we are not able to provide the answer, but we can look into that.
The other thing was about the use of AI, right? Because when it comes to mental health, I think around the world we see issues about how people are using AI. This is on a public front, right? Using AI to address their own mental health issues, obviously on an unsupervised platform. But incorporating this in a more structured setting, what are the guardrails that you put in place, especially from a security point of view and also hallucination point of view, to make sure that the people get the care that they need?
So we follow, in terms of security, we follow like one of the highest standard HIPAA compliance with the data privacy of the people. It's very important. And we also store everything in a EHR, okay, electronic. So that is one of the things, you asked me earlier, somebody seeing an intern or next counselor, all the data goes so that if you see anybody, you can able to get the treatment. Using AI, we can also able to predict for you quite a bit, self-assessment and many other things. See, because it's not a chat GPT, what I'm talking about. People go today, Google and say what happened. That's not really driven. But here is going through, this is the ISO standard actually what we follow, and HIPAA and the high trust certified environment.
How do you measure a successful outcome of a case or a patient?
So we do have a pre-assessment, from a clinical perspective. When a client comes in and registers with us, so we do have an app that they can, once they register, they will be doing a pre-assessment, using DAS and PHQ. So from there, we will then have like a, post-assessment from us to ensure that, we can measure the success. And if there's anything needed, then we will assist further.
What about do you offer packages or convention for the way
Yes.
group?
Yes, we do.
We are trying to work with NGOs as well, as much as possible. That's for CSR.
Yes.
Does it requires a doctor referral? Like for example, the government hospitals, they requires a doctor referral or a police referral before anyone can go to a psychiatric hospital. How about MindNexis?
It's both ways actually. It's either the psychiatrist pass down to the psychologists or counselors, or the counselors pass it up to the psychiatrists. Yeah. So if there's anyone from the other hospitals that if they need the services, we actually
However,
are able
a
to accept.
referral is not necessary.
Not necessary.
Yeah,
Just
we
they can
accept
walk in.
walk-in.
That's
Correct.
it. Okay.
Any other questions to clarify? If there's anything else you want to add on before we
Just one
Yeah.
open question. We have a lot, in Malaysia, we have a lot of cases of school bullies, road rages, recently. A lot of things. What is your opinion? Why is it happening it's getting so bad in Malaysia?
I can tell you something. This is not a problem with only your Malaysian schools. I'm seeing it happening in the US. It's happening in India. That's what when they say some news, I got really thing. When I'm studying in the school, the teacher can beat you. Now actually the student is beating the teacher. The Gen Z has a very very big difference. And everything. When a child is born, they're looking at, they know how to do your videos, Instas and other things. Like that, they're seeing so many things. The mind is getting to. So, and especially the COVID, I'm seeing after COVID, many children got a problem of cell phone addiction, actually. These are the things, because then they become a very secluded and then they really do the very, very difficult, actually. So, it's a common problem. Dr. Bala's son, Dr. Bala has two daughters, both of them are a doctor also. The son is going and complaining in the school, my dad is not paying attention, even though he's a doctor. I'm saying, just giving you an example, even if children come from a very good family and good support and everything, they have this problem. So I see, if you have anything to say?
Yeah, we wouldn't know until the research is done actually. So I don't want to say anything much about it.
But it is a common read, that's what you can do.
Correct. So I think it's from a biopsychosocial factor. There's a lot of factors that's involved when it comes to bullying. For example, some child will be like very quiet at home because of like very strict discipline, and when they go out, then they feel like they can do anything. And another thing is also, I think what's happening is the support that they are having in the school as well. If you see counselors, not enough. There's only one counselor. And students in the school will be like nearly one class is 40 students. So it's very hard to even control, and have like a strict discipline. If you see in our era, it's like very strict, there are rules. But here now it's like very easy to break the rules, right? So, and also the ratio between the teacher and also the children. And if you look at at home, everyone here need to work, right? And there's lack of attention to the children. Hence, I believe that could be one of the factors when it comes to bullying.
Okay.
Yeah.
Thank you so much.
Final question, just one final question.
Okay.
If Mr. Suresh, you can elaborate on who are some of your specialists here. And
okay, I think I give this opportunity. She goes to tell, because we have many set of people. Citra and Dr. Lokesh has recruited very good amount of people. You will see some of the people in the panel discussion also right now. What did you say? Highlight some of your key people.
Yeah, so we have all experienced clinical psychologists. We ensure that we accept only those who are more than 5 years in experience. And we have Madam Marquez, Miss Hasni. I think you can see Madam Ilani is as well part of our team. And from the medical part, we have Mr. Ras. Dr. Ras on board as well, and we also
and there is a lot of people, psychiatrists going to come and practice here, including Mr. Ko and other people here who has like a 20-25 years of psychiatry. Dr. Andrew Mohan is here. He is also a renowned psychiatry, and many people will be practicing here.
Yes.
With over a decade of experience in higher education, counseling practice, and public engagement, she is a certified reality therapist, having obtained her choice theory and reality therapy certification from the William Glasner International in the USA, and is also a certified counselor, supervisor with supervision training from Idaho State University in the US. She has also completed her supervision certificate with the Malaysian Board of Counselors. Please give a warm round of applause for India. Next up, I'm going to invite up Dr. Fauzia Hamza. Dr. Fauzia is a highly recognized family medicine practitioner with over 27 years of clinical practice, She is recognized for her patient-centered philosophy, emphasizing individualized care and treating the whole person. That's great, isn't it? The whole person, rather than just focusing solely on presenting symptoms. Her approach integrates the medical expertise with a comprehensive understanding of each patient's physical, metabolic, hormonal health, and now it also includes mental health, right? Areas of expertise include the family medicine, chronic disease management, obesity treatment, hormonal corrections, autoimmune management, and anti-aging rejuvenation. So please give a round of applause for Dr. Next up, we have Dr. Siva Mohan Namasivaya. Welcome. Dr. Siva, if you don't know already, is a distinguished obstetrician and gynecologist with a subspecialty expertise in gynecological oncology. It's all very, very big words for me today. He graduated with an MBBS from Mysore University and went on to complete his postgraduate training in the UK, where he is both a member and fellow of the Royal College of Obstetricians and Gynecologists. He's also been awarded the prestigious Commonwealth Scholarship for Advanced Training in Gynecological Oncology at Oxford, right? In addition to that, he has his extensive clinical experience and he holds a master's degree in healthcare management from the UK and has served in several senior administrative and leadership roles. And today he brings a very unique and valuable perspective on mental health, particularly at the intersection of women's health, oncology, and holistic patient care, especially with menopause and all these things. So please give a big round of applause to Dr. Doctor. And our final panelist, we have from very here itself, Dr. Alvin Ng. Sciences at Sunway University, Malaysia. He is a clinical psychologist by training, previously attached to the University Kebangsaan Malaysia for 11 years as an instructor and a practitioner in clinical psychology. Now he served as an honorary associate professor at the College of Life and Environmental Sciences, University of Exeter, UK, an honorary senior lecturer at the Norwich Medical School, University of East Anglia, and was the adjunct senior lecturer at the Jeffrey Chia School of Medicine and Health Sciences, Monash University. Dr. Ng's research areas include mental health literacy, positive psychology, mindfulness-based cognitive therapy, and cross-cultural factors in psychotherapy. Cross-cultural actually works a lot in Malaysia, isn't it? Right? And he was also the founder president of the Malaysian Society of Clinical Psychology that he helped establish in 2010. Please give him a big round of applause. Okay, thank you so much for being a part of it. Cynthia, we often hear that mental health system is extremely fragmented, right? Now, what does that look like for a family? And how does MindNexis here solve it?
When we talk about MindNexis here, we cover because we are multidisciplinary, we cover every areas. So instead of like going to one, let's say for example, your kid has a problem and you just go for child therapy, but that doesn't help to solve. So here we cover family therapy also. So we work with the whole family in terms of to help resolve the problems.
Are we assuming that the family is the problem, not the child?
When we look at a child, right, where does it stem from? It comes from the environment. It comes from the surrounding. Yes. So yeah. So if you want to tackle the child alone, it doesn't work. You see, it's very easy. You do counseling with the child, and then you send back the child to that environment that enables the problem. So does the problem get resolved? Obviously not. So when we do family therapy, we cover the whole environment. So that helps.
So that's what you do here at MindNexis, and maybe you want to spell out a little bit about the holistic way that you all do it here at MindNexis, the kind of counselors and psychologists and psychiatrists that you have within this one group itself.
Okay, we have people from different backgrounds, especially specialized people who have been in the industry for very long. We have family therapists who have been in the industry for very long. We have clinical psychologists with years of experience. We have psychiatrists, we have counselors, so we have addiction counselors, we have clinical psychologists who have specialized in addiction, couple therapists, and those with family therapy background. So it is basically a one-stop center where you get everything, instead of you going from one different center to another center.
So the handover from one discipline to the other is within this roof itself, and people are able to seamlessly glide between that to probably get help for themselves or their loved ones as well, right?
Yes. So you see, the first contact point will be a counselor. When you come to a counselor, we have our certain limitations. We do therapy, we can't do assessment unless we are trained for the assessment. We go for special certifications for the assessment. So when we work with the client, if you see the client needs further assessment, then we refer the client to a clinical psychologist. And then the clinical psychologist does the assessment. And after that, if the client needs medication, then we refer the client to the psychiatrist. But again, after the medication, the client needs to come back to the counselor to work on the emotional part of it. Because the medication covers more towards the biological part of it, the neurotransmitter part, the medical part of it. But then the emotional part of it, you need to come back to the counselor to work on it for the therapy.
Okay, so it's everything, it's done here. So I'm going to go next to Dr. Alvin, right? If you could pass the mic across to him. Dr. Alvin, you take care a little bit more of multidisciplinary model, right? Maybe you want to explain a little bit more about the multidisciplinary model of care and how it will be able to reach out to a larger pool of the public, help them, so that they have access to the help that they need.
You were asking about multidisciplinary approach.
Yes.
I'm glad you asked that, because when it comes to any of our health, it has to be multidisciplinary, because not every one of us as health professionals are expert in all areas. So for example, let's just take matters of the heart, cardiology. If you have a heart problem, we know from research that you're also very likely to have emotional problems. Partially because sometimes certain emotional problems like high stress can contribute to heart disease. So two professionals really you need to see. You need to see mental health professional, you need to see a cardiologist. So two disciplines. And on top of that, you probably need to see a neurologist as well, because it's going to affect the brain. Like I had a stroke, partly because of stress. Yeah, I'm a full-time academic, it's brutal in universities. Yeah. So when that happens, you need to see at least 3 specialists already. And in my case, I also had to see a blood specialist because apparently I've got a blood condition as well.
Okay.
Yeah. So if you get all these people under one roof, it's easy. You don't need to go from one center to another center and then appointment to another center. So when you have that approach, you actually provide a lot of efficiency with regards to personalized care. And I'm glad that when you introduced Dr. Fauzia, you mentioned personalized care. I think that is the way to go, because if you focus on the individual and what they need, you then can better understand their needs and then know who to refer to. I think that's something they have in the UK. They actually have a profession that takes care of your health. So they are the ones who are like your personal assistant for going to the hospital. They know when your appointments are, which doctor you are seeing, and why. And they can help manage your appointments in a way that helps you. Can you imagine we have such thing like that in Malaysia? We probably have people like that called social workers, but they don't do that kind of work because we haven't got enough of a system to support something like that. That's wishful thinking. But yeah, a multidisciplinary approach would help the user in that it makes it more convenient. You go to one place and you are seen by all these specialists who can help you. Why not, isn't it?
Yeah.
And we are seeing more and more research these days showing that even when it comes to mental health problems, you can have neurological interventions, something like transcranial magnetic stimulation has been found to help a lot with depression, especially those who have got depression that is not responding well to medication. You put this metal plate on your head. I call it the excuse my slowness, my brain is slow already. The woodpecker treatment, because it feels like a woodpecker pecking on your head, tuck, 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 but it's magnetic resonance. Somehow it does something to your brain that reduces depression. So, are we having that here?
Not yet.
Not yet. Maybe.
Not yet. But in future, yeah. What do you call that?
TMS, transcranial. Trans is like
transcranial.
Cranial, as in cranium, our skull.
Yeah.
Magnetic stimulation.
Okay.
It's non-invasive.
Right.
It shoots magnetic signals into your brain, targeted at a particular part of the brain, to stimulate it in a way that helps it to heal. I went through it as a stroke patient. It's kind of cool to lie in a chair and get this woodpecker pecking on your head. Yeah.
Okay. All right. Thank you for that. Dato, I'm just going to allude to you because Alvin brought up about multidisciplinary. You've been in clinic. You've been in Australia for many years, and you've done a lot of work outside of Malaysia as well. In the UK. How often have you seen patients who need mental health assistance? Because there are many. Your specialization, which is in oncology, women in gynecology, and we know the situation in menopause, right? Do they have access to help? Mental health help? Because getting a cancer diagnosis is traumatic. Maybe you could share with us some anecdotes or some experience.
Yeah, thank you very much. If you look at the definition of health by WHO, it states that it's a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And this definition was coined way back in 1948. And how futuristic is this definition? Because it talks about physical, mental, and social well-being, and social problems that are here now because of social media and all this. I think all of us would have heard, most of us have heard that 3 sisters committed suicide in India last week because the parents stopped them from using the phone. They were watching too much of Korean dramas. And 3 sisters committed suicide. It's a huge social problem. So the definition is very appropriate. And to tackle your question, I think I'll divide this into 3 parts. As an obstetrician, okay, as a gynecologist, and as an oncologist. See, in terms of obstetricians, dealing with women for nearly 40 years now, we have all become automatic counselors. Yeah? And so it's not really necessary to refer cases to counselors. Of course, they are important. And we know when the time has come. In certain cases like bipolar disorders, psychosis, and sometimes suicidal tendencies are all that. Of course, we need special help from specialists. In terms of obstetrics, you'll be surprised that 20 to 30% of married couples come to us with problem of not able to conceive. Such a basic thing, 20 to 30% of patients, infertility patients come. And because of the work-life balance that you're going through, the stress, the pressure, and the reproductive cycle depends on hypothalamus, pituitary, ovarian, uterine axis. So environmental factors is creating havoc. And imagine a young man at the age of 28, 30, just starting life is told, or your sperm count is bad. Okay? This is for your personal, you feel incomplete. Same thing, there are certain tests that are done in women telling that although your biological age is 28, 30, your egg size is older 70, you can't conceive, things like that. And these are issues that really affect young couples starting off with life. And this is very common nowadays, okay? And the use of IVF techniques. And even using IVF techniques, not everybody is going to succeed. And it's a very stressful journey, from the hormone induction, going through the oocyte retrieval, and just to find out their success and all. So that's one aspect of it. Secondly, of course, women miscarriages are very common. That affects women. And unfortunately, sometimes, however good we are, how much are caring we are, we still see unexpected fetal deaths, intrauterine deaths, fetal loss, either just before delivery or during delivery sometimes. And the women, the mother, the parents, the family has to undergo this whole grief reaction and then accept it. Then we are talking about babies who special need children like autistic. Affects the whole family, not just the mother, the children, the whole family is affected. So it's again a different approach. And then when you talk about deliveries, postnatal blues, postnatal depression, psychosis, all these things need to be addressed. Now coming to gynecology, I don't want to spend too much time, but it's a condition called polycystic ovarian syndrome. And when you talk about this problem, it's a metabolic disorder where women tend to put on weight, excessive hair growth and all that. And so here we call it something which is not expressed openly. People don't talk about it, but it is a big major problem. And of course, menopause is something every woman will face. Nothing has changed except maybe the lifespan of women has changed. That's the only thing. And about a third of women who will accept it as a normal physiological process. Another third may need a little bit of counseling, but there's another third of women who really go into depression and need special attention. Okay? So that's part of gynecology. Now to answer the last part of the question, dealing with women's cancer. This is something not uncommon nowadays. It's 1 in 3. Not 1 in 4, 1 in 3, especially after post-COVID. I don't want to cause any sensation, but something to do with COVID or the vaccine or whatever we are seeing. Many young women with sudden onset of cancers, active, aggressive cancers. So the first question is, why me? I've been eating well, I'm exercising, I've got no bad habits, and why me? Okay? So it's like a throw of the dice. And then women used to, consider cancer at one time as sort of a death sentence, which is totally untrue. Nowadays we are picking up these stages, it's curable disease. We treat them just like any diabetic or hypertension. It's so common nowadays. But the thing is, they go through a lot of emotional problems, especially going through chemotherapy, surgery, radiotherapy, and so on. And it's not a one-man thing. I think it's a whole family gets involved, and the society around them gets involved. So cancer is something, and especially dealing with women, is also considered regarding sexuality, body image, and so on. So that's again a big role for counselors and to help them see through all these cancers and all those things. So I think these are the important areas that we did.
Well, I have to say that it was absolutely pin drop silence when you're talking English. You're making sense, and I get a understanding that it's really hitting home for a lot of people in a lot of ways what you just expounded on.
Yeah, I think it's a reality, and I think there's no taboo. That's a good thing about this is we all need help sometime or the other. We are counselors. We counsel as parents, as children, as spouses. Maybe spouses sometimes you get lectured rather than counseling. But it's part and parcel of we are all helping each other, and as teachers, as doctors, as whatever profession, we are all counseling each other every day. So, and then thank God that we have experts like the panel here, counselors, psychiatrists, psychologists, to help. And I think if you look at the range, even top CEOs, because of the stress and strain that they are going through, the type of lifestyle we have today, I think even simple things like menstrual disorders in women is related to stress. And if you ask me, even heart disease, cancers, everything is ultimately related to stress. And I think that's where stress management, parenting skills, and all these things are coming out, not because they are specialized things, it's a necessity now. And I'm glad that there's so many people here today to listen and be aware of these things. And there's nothing wrong to seek help. We all need help. Okay? And there's no stigma. And I worked in UK for 7 years. I see top people, top CEOs, and stop going for psychiatric help or counseling. It's a normal thing. There's no more stigma. It's something which is very, very. So, faced like this, if we all seen here today, it doesn't mean that we all are depressed or mental illness. We came to learn and be happy here. Yeah?
Yes. Absolutely. Thank you for that. Because today the reason why we have this panel here is to just bring home the message to everyone that MindNexis is here and it's available for everybody, right? And at the same time, it's not only multidisciplinary, but it's also very holistic in the sense that when you come here, you can see all these differences. And we've heard from a counselor, a psychologist, psychiatrist over there, an academic, and then you're hearing from someone who's a specialist, who's been in the clinician, I know, for about 40 years. And now, to really take home the message to everyone, I'm going to ask Dr. Fozia here to talk a little bit about the GP practice, because she's the medical director at Clinic Cahaya. And there are 14,000 GPs in Malaysia. There are 14,000 GP clinics, right, in Malaysia, which makes us absolutely accessible. Malaysia is very proud to say that we have a clinic where we can go and get help within 5 kilometers of where we live. But what is the kind of help and how do we get it, right? And especially when it comes to mental health. I mean, I'm sure you've been, 27 years here doing this, right? How often have you seen patients in your clinic who need this sort of mental health? Because that's the first place that they turn up in, right? At your doorstep. In the middle of the night or in the daytime. And we're talking, Dr. was mentioning, Alvin was mentioning about stress. That's what everyone in this room probably goes through some sort of stress. So maybe you can tell us a little bit about the GP practice and the amount of patients that you see that fall into this category. Maybe Dr. Fozia.
Thank you, Manuel. Well, being a GP for a long time, and I would agree with the panel and also with Dr. Suresh, where earlier he mentioned regarding COVID. After COVID, a lot of things happened. Indeed, it became awareness. After COVID, a lot of people, individuals, including family, children, grandparents, and all, they were going through different stages of, I would say, probably like depression in many ways. It's a big word of depression individually. So these people were going through that, and then when the COVID era was over, and some lost their job and they have to embark again into a new job, they go through a lot. And on top of that, like Doctor said, these babies that are born lately, delivered lately, we are seeing a lot of ADHD, dyslexia, autism, so many new names which we never heard maybe during my era where we are schooling. We never had this kind of children. Now we are seeing a lot of cases among children, and when they come to the clinic, we are the first line. They come to us first line. They come, children are running, they can't, they have a lot of, the parents carry a weight with the kids running here, running there, and maybe one child have the disorder, but the other sibling is going through the trauma because the parents attack the other siblings to manage the other child that is not well. So in that sense, this is a very broad explanation that I may be talking and diversify in many ways, but eventually what we GP do is that we have to be more patient, receive them, calm them, because each one of them need an ear to listen to them. The mother, the father, and that mother and father could be going through a lot of problem themselves, leading to a divorce, which I've seen, and and the kids themselves, the siblings are breaking up. So in the primary, that's in families. On top of that, additional is the people in the working sector. Depression due to work stress. Depression due to environment in the working place. And distance from working place. So a lot of things is coming into them, causing them to go into anxiety, depression, stress related, and eventually they don't know why they are working. So I see a lot with this case, but the only problem, I do my best. I will set my time in a different way to approach them and give my time so that I need to spend time with them, not 10 minutes like a GP practice. Cough cold is waiting. So we have 2 rooms, 3 rooms. I just say, excuse me, run, and I come back. And I see them back again because I don't want to lose my patients. I need to channel them to a proper channel. And today, with MindNexis, I'm very, very glad to have this platform, which I don't want to use the word psychiatry to anyone. Because the moment you tell them you have to see, in Malay, mental doctor or psychiatric doctor, they feel they're already having a stigma. So we have to use our terminology in a proper way that they don't feel offended. So we have to be part of their family. I have to go to that level, be part of them, receive them, make them happy that there is a place. So with MindNexis, having all this platform arranged in multidisciplinary ways, and we can tell them this is for mind, body, and wellness, so they may feel more open to be there. So for me, for certain cases which are suicidal attempts or ADHD, which is ASD, autistic, they have 4 spectrums. The last spectrum is the worst because unmanageable from the mother, from the father, and the kids themselves and the sibling. So they really, really, really need a proper center to manage them. Not only the child to be managed, parents themselves need counseling. So all this matter need to be looked into carefully, ideally, and give them the best so that they don't give up, they continue so that we can mold them and encourage them into a better platform for a better future.
Well, thank you. I mean, you've just given us a little inkling into what you see in your clinic that, I think a lot of people are not aware of. I've got one more question and I'm going to leave it to your, just put up your hand, I'll bring you a microphone, wherever. So I'm going to go to you, Cynthia. Bullying has become an issue that we're talking, Is it real? Is it not real? I mean, because most of us here of a certain age, we've all been bullied in school, but we're not in school today, of course. But today we see that stress in school and children dealing with it in a different way. I'm not saying it's right or wrong, but it's just a different way from what we experienced then. And then social media bullying, which I mean, to me, it's not real bullying lah. I mean, but that's, because it's not happening to you, not somebody pushing you or pulling your hair or doing something like that. But it's social media bullying, but it's real to them. So it's different. And how would you at MindNexis be able to help, not only the person who's being bullied, but maybe the parents as well? How would you deal with that?
Okay, if we talk about bullying is real, whether it comes from social media or physical. Most of us ignore the social media part of it, okay? When we look at bullying over social media, just imagine when a particular child or a particular adolescent, when they go on social media and one of their friends shame them on social media, that can really leave an impact, okay? And there have been cases like this where the child or the adolescent have even attempted suicide. So social media is not something to be taken lightly, especially when it comes to bullying. Okay, so bullying really leaves an impact in a child. Sometimes children, they don't cry out. They keep it to themselves because when they inform their parents do not listen. And the parents usually say, oh, it will go away, or it's just a phase that you're experiencing. But actually it's not true. It's not a phase, or it will not go away. So as parents, how do we work with them and we work with the child is basically at MindNexis is we provide them therapy, family therapy, we work with the kids, we work with the parents, we improve the communication between the parents and the child. So not only that, on the other hand also we work with the child's emotional and mental health well-being also. And then we tackle it into family therapy with the child and the parents. Most parents feel that, okay, I don't need therapy, my child needs therapy. But no, it's not just a one person's problem because you're dealing with it as a family. And as a family, we work together as a team to help each other. When one particular family member of you have a problem, it's not just that person's problem, it's everybody's problem in the family. So why do families collapse? Because when each one of us think that it's not my problem, it's my brother's problem or my sister's problem or my mother's problem, that's when the problem starts to escalate. So here at MindNexis, why we emphasize on family therapies, we work with everyone to provide the best care for the families.
I may have not, I don't think I have a question that's related to health or anything like that, but more on the young generation. You have covered about children, you have covered about kids and all that. But I would like to cover a little bit about the young adults. We are talking about the Gen Z. So I'm from the higher education sector. And one of the biggest concerns we have is, thanks to COVID, a lot of students who have been on online teaching, online learning platforms and things like that, we are seeing more students withdrawing from getting prepared for the working world. More students are facing depression. More students are feeling very withdrawn. How can MindNexis help these students? Counseling might be the only way, but is there something else that you would be able to help? Because again, all these kids, as growing up, they grow up perfectly fine. So how do you work on this next? Thank you.
Cynthia?
Okay. I've been in the education industry for almost 10 years. I was a lecturer myself. Yes, I have seen students, the same problem that you're experiencing, I've also experienced it. Okay, the Gen Zs, I would say the Gen Zs, they are a very gifted generation, I would say, because everything is given to them. Okay, and it's at their tip of the finger with that glass piece there where you call phone, where you just press and you get everything at your finger. So yeah, so in terms of that, which is why they resolve towards this way. So resilience is one of the ways that we can help them with to build their resilience, okay, and to understand them. I've known a lot of Gen Zs where they join workforce and less than a month they quit the workforce because they cannot take the pressure, okay. So yeah, so and it's scary because these are the generation that is going to be our future leader of the country, okay. So as an educator, I'm also, part of me is also scared. So what's going to happen? And these are the students I'm nurturing. But then again, come back to us. Resilience is very important. Their self-esteem. How we deal with the Gen Zs are very important. In today's generation, you need to speak to them. Okay? When you give an instruction to them, when you boss them, you tell them to do things, it doesn't work. Okay? You need to speak to them, you need to be like a friend to them. I know in the education industry it's not easy because we have our boundaries as lecturers, but then again we try our best because we are the first point that they come to before we send them out to the world. Okay? So, and as parents also, when we speak to our Gen Zs, make sure we listen to them, what they are trying to say. Sometimes it may not be reasonable, but we try to negotiate with them. Okay? It is not easy, but we can try. It doesn't work like back then, those days, where you give an instruction and they don't question. Nowadays, kids, adolescents, they are very smart. Okay, you tell them A, they'll tell you X, Y, Z. Yes. Yeah, so I have two of my students here. They came today to help.
Is that the
Okay?
one to say?
Yes. So I was their lecturer. So basically, they know me how I communicate with them. I mean, you're an adult, I treat you like an adult, I give you your assignment, you do your assignment, you come back to me and ask for extension, I ask you for a justification, I don't just simply fail you. So they know my style, they know how I work. So you need to be a friend to them first before you can actually work with them closely to know what they want. Okay? So we need to understand the thing is that today the Gen Zs are not easy and they are not like our generation. So try to talk to them, try to understand what they like, try to be a friend with them for you to be able to approach them. Then you can see probably it will change your relationship with them and your communication with them.
Well, it's a great answer. I've got one more question. Okay.